yes, we all know it's Sunday and it's time to know about doctors' personal opinion and advice and their experience. So this week we have Professor and Head of the Department of Orthodontics in Sree Balaji Dental College in Hospital, Dr.M.S. Kannan, who has completed his UG in Sree Balaji Dental College in Hospital and done specialization in orthodontics at A.P. Shetty Memorial Institute of Dental Sciences. And Dr. Kannan has guided 22 research projects till date and authored 42 publications in various journals, out of which one is an international publication. And he has also served 10 years in the head office of Indian Orthodontic Society and 3 years as EC member and 4 years as joint secretary and 3 years as editor of iOS Times. And it's an immense pleasure to welcome such an inspirational doctor to share his experience in the field of orthodontics. Welcome, sir.
Hello, hi Sana.
So how are you doing, sir? It's been a year of lockdown, and how was your experience both clinically and personally, sir?
Yeah, I'm doing perfectly fine. So I should say, yes, globally it's been pretty devastating and so many people suffering. God's grace, people are good over here. I'm safe. And I see always a positivity in whatever is happening. So the positivity about this pandemic and the lockdown is I got more amount of free time. And I mean, it's like spend time with you all, spend time with my family. Clinically, yes, but I won't say so much affected my practice as such, because only thing is clinically, I had to completely reformat my 20 years of style and system as such. I had to put in some extra measures to adopt a lot of sterilization protocol, personal protection for that matter, and especially personal protection for my own patients. So I had to invest some little amount in reinforcing the sterilization protocols. And once everything was good and it is like my patients felt comfortable and confident, then there wasn't a serious problem as such. And now today it is like I just make it a protocol that any patient whom I'm going to treat has to be vaccinated. So apart from kids, if the patients are not vaccinated, I don't treat them. So I feel myself secure and my team secure in treating patients. So I personally wouldn't say that lockdown or this pandemic has affected my practice at all. I'm absolutely fine with the practice. It's absolutely good.
So what made you choose orthodontics, sir, and why did you take the decision to specialize in orthodontics, sir?
Orthodontics is a wonderful field or a wonderful science. If you note, Sahana, it is like all our definitions, right? It all starts as art and science of prosthodontics is the art and science of endodontics is the art and science of orthodontics is the art and science of, so always you remember there is a quotient of big quotient of art along with these sciences. So especially ortho is a wonderful science which has got a lot of art involved in it. And so it is like basically I felt that this particular field is a very artistic field. So that's one reason I pursued orthodontics.
Okay, sir. Since the pandemic, students started taking online classes. So, do you think the students are missing the practical exposure, sir? And how that can be brought back into practice, sir?
Yes, a very good question as such. This is something which I would say the education system is badly affected. Education system as far as dental education is concerned, I would say it is like it's taken a very big impact. Sahana, you would know that our curriculum as such consists 80% of practicals in the first 2 years, and the next 3 years, 80% of our curriculum is clinicals. Now, all our students are badly missing this 80% of practical and clinical exposure. That is going to make a very, very big impact on training them, teaching them, and molding them as dental professionals. So anyway, hope things all mellow down soon and all our students start getting a clinical and practical exposure. I don't think so online education alone would do justice in teaching our students, especially our dentistry in particular.
Are online classes effective, sir? And what is your opinion on reopening of schools and colleges during COVID-19? And is it safe to restart the colleges now, sir?
Definitely, it is not safe. Absolutely. You know very well, it is like your own classroom. Our classrooms supposed to have 100 students who are sitting together, and it is absolutely not safe today to call all the students and make them pack them in a class, whichever standard they are in the school or in the college. So our only hope and for the future is like we can't wait for COVID to completely vanish overnight. So our government is doing a fabulous job as far as doing a mass campaign with vaccination. So in future, not future, in closest of future, the government should adopt a mass vaccination program for the children as such, and children and college students. So once the children and college students are all vaccinated, of course, yes, that would be a perfect time to call them all and start with a regular routine of classes or the clinics, or I would say even the practical classes.
In your advice, sir, what is the right age for a person to begin with orthodontic treatment, sir?
Orthodontic treatment, the best age would be like, I would invariably it's 12 to 15. So the 12 to 15 years is what I call as a golden age, because yes, you have to wait for the root formation to complete. You know, orthodontic forces has a tendency for early appreciation or the root tips to close. So ultimately, that is what we mean by shortening of roots. So for not that to happen, we have to wait for the epixification should happen. So perfectly chronological age would be around 11 or 12, and 15 by 15 they almost complete their facial and dental layer growth. So make the best use of growth means yes, 12-15 is the golden period. But that doesn't mean that you wait till 12 and you don't start with your treatment. You know, there will be some devastating malocclusion, a very serious malocclusion. Imagine a child with a cleft lip and cleft palate. That means what? The third day of the childbirth, you might have to start even with nasoalveolar molding. So there are special cases which requires intervention even before, from the birth and even before 11 or 12 years of age. But invariably 80-90% of the cases, the best time would be to categorize, start the treatment by around 12 to 15. The results are very promising, results are faster, and more importantly, results are more stable.
Okay, sir. Till which age we can do orthodontic treatments, sir? Like beyond what age we cannot advise orthodontic treatment for old age people and also? Is there any limitations?
A good question. There is no age limit as far as orthodontics is concerned. You know, it's like even let the patient be 70 or 80, there should not be an issue. Even 90, if a patient is willing for orthodontic treatment, I am confident and I'm sure that I can give a result. It just the mechanics which differ and the type of forces which you apply which differ, and definitely the results are not as fast as you treat with the kids when you're treating somebody who's 50 or 60 plus. But absolutely, it's possible to treat a patient at any age for orthodontic correction. And if you really check out for rehabilitative orthodontics, what I mean by rehabilitative orthodontics is when you're trying to do an orthodontic result for a patient to support him for his reinforcement procedures with prosthodontics. So really ortho comes in play, and that is has to happen at around any age of the time in elderly phase, say it be 70 or 80 even. So it's absolutely possible. Age is not a limit at all.
Yes, sir. Even I have seen you practicing in which you replace the first missing molar by pulling out the second molar to the place of the first molar and third molar to the place of the second molar. So, how successful this treatment has been, and is there a proper awareness on it, sir?
I would say those are little. I would categorize those type of treatment as more adventurous orthodontics, you know, and it took at least 10 years for me to get the confidence of transpositioning a 6 into 7 or 8 into 7. But once I learned the art of doing it, so it's almost for past 10 years I've been doing this adventure orthodontics. So it requires a lot of expertise, knowledge, wisdom, and experience to give those results, but it's absolutely possible. And your question about how stable are these results are, it is very very important that when you move a teeth from one position to another, okay, the new position where you finish your treatment with has to be perfectly in a stable position. As far as that particular tooth or teeth does not receive any heavy functional impact, disturbance, I should mean that what I mean by a functional impact. And if the tooth which is transposition or newly placed into a new position is comfortable in that particular position on offering its day-to-day activities like mastication, chewing, deglutition, swallowing, or even speech for that matter, and aesthetics in particular, if the teeth are in comfortable state, the results can be absolutely stable. So it's not a big deal or a big question about questioning or challenging the stability of doing such dramatic orthodontics.
So we are all asked to practice wire bending during our academic years, sir. So how wire bending will be beneficial for undergraduate student to assess the orthodontic treatment, and our UG students are allowed to practice orthodontics on patients, sir?
Wire bending is about developing your skill. Orthodontics, as I mentioned earlier, is just not a science alone, it's also an art. So you need to develop the skill of art. So tomorrow you go to a painting school or an art school where you are learning to do drawing, caricatures, or painting. Ultimately, your fingers needs to be trained in holding the paintbrush and the wielding the paintbrush and producing the art which you pursue. So same way, orthodontics require a lot of finger training. So ultimately, we are giving the results with wires. It's like wires and brackets are integral components of an orthodontic appliance. So it's very, very important that you develop the skill in your hand and with your fingers on wire bending. That's the reason we train our undergraduates right from third year on orthodontic wire bendings. But as such, I would personally say that orthodontics is a vast science. Your undergraduate training alone is not adequate to offer this exposure towards the science and experience, particularly the clinical experience to treat patients. So you require a 3-year postgraduate program definitely. So what you learned in third year and final year and internship is basic amount of orthodontics. The idea of having this portion of orthodontics in your undergraduate curriculum is, as a dental faculty, as a dentist or as a specialty dentist from any other specialty, you should have a basic knowledge about diagnosing treatment, orthodontic conditions, planning treatments, and to look at where the patient's chance. And once it comes to offering a treatment, I would say you require definitely a 3-year postgraduate training to offer a quality orthodontic treatment. But from what you learn with the minimal amount of orthodontic appliances, you can do some minor corrections as an undergraduate, like closing of spaces and retracting anteriors, which are minimally proclined, or give habit breaking appliances, or even some entry level functional appliances can be given by an undergraduate student.
For children in specific, we have orthopedic appliances. For the sake of our viewers, can you please explain what is orthopedic appliance and what is the correct age for the child to take or undergo the orthopedic treatment, sir?
Yes. So before I answer this question, I'll have to state that orthodontic problems as such falls in 3 major categories. First is your orthodontic problems. What do you mean by orthodontic problem? Is where you have a problem only with your teeth as such. So moving your teeth into a more favorable position as far as aesthetics and functions are concerned, you need an orthodontic appliance. Okay. Next category of problems is the orthopedic problems, where there is a defect in the development of the face as such. So once I say face, you divide the face in 3 major components: the middle cranial fossa, or what you call the forehead, the upper face. Okay, the maxillary component, which almost covers the nose also, and the maxilla, and the mandibular component. So when there is a disturbance in the growth and development of any of these 3 components, the maxillary component or the mandibular component or the middle cranial fossa component, then comes an orthopedic issue. So you correct these issues with an orthopedic appliance. You get the point. And the third category of problems would be functional problems. So when a patient is showing a functional issue, a patient is not able to, a patient who has developed a mouth breathing habit, a patient who has got a very poor chewing habit, okay, a patient who has got a chronic tonsillitis and has got a throat obstruction or a pharyngeal obstruction, so that reason the mandible can get retruded. So these functional problems can have secondary orthopedic and orthodontic problems. So when there's an orthopedic problem in a functional issue or an exclusive orthopedic problem like a prognathic maxilla, or what do you say, the jaw being forward or the mandible being forward or the mandible being placed backward, then comes the role of orthopedic appliances to correct them all. So one more thing I like to state here is there is no exclusive orthopedic treatment or an orthodontic treatment or functional treatment. So all these three problems happen together basically. One factor predominates. So you choose, when there is an orthopedic problem which is predominating, you choose a major orthopedic appliance, and then the finishing and detailing you make it with any functional appliance and on orthodontic appliance, or vice versa. If it's an orthodontic problem predominantly, you correct it with appliances, and then you might have to use a minimal amount of functional appliance and orthopedic appliance. Orthopedic appliances can work only during the growth phase when the patient's growth is complete. Chronologically, I would say a girl matures earlier. So that means a girl's orthopedic age limit would be 16 or 17, or a boy little matures later, probably 18 or 19. So, and to make it straight to the point, after 15, I don't think so any orthopedic appliances work. Major amount of orthopedic corrections happen from age 5 to age 15.
Okay, sir. So the options are endless when it comes to orthodontic treatment, sir. We have metal brackets, ceramic, multicolor, lingual, and even now we have Invisalign in trending, sir. So in all your experience, years of experience, which one is the most effective and practical and economical choice, sir? What you recommend, sir?
See, there are huge array of choices for the orthodontist to choose the appliance. You know, it is like there is a huge variety, as you say. There's a lingual appliance, the ceramic appliance, and ultimately, it's not like I would say any appliance is superior or any appliance is inferior. The object of any appliance is to give the same end result. Let it be the lingual appliance, or let it be a ceramic appliance, or let it be a metal appliance, or let it be even aligners for that matter, or Invisalign. The objective is to give the same result. So with the ease with which you achieve the result matters. So I would quote that metal self-ligating brackets today are the best appliances to give a perfect result, which is very easy for the orthodontist, very comfortable for the patient. And when there is a demand about aesthetics, the patient cannot disclose the appliance, or patient does not say somebody is in a media, somebody is an actor and actress, okay, or somebody is like an aerostess where his or her boss is not allowing her to wear an appliance because she is presenting in a social forum, or uh, addressing a public cause. So those cases you consider an aesthetic appliance. Let it be a lingual appliance which is completely hidden in the backside of your teeth, or a ceramic appliance which is tooth colored, or even aligners for the matter which is absolutely invisible. So, but end result, any appliance has to give the same result. You know, it is like the mode of delivery or the mode of action varies, but the result has to be the same.
Okay, sir. Now we have Invisalign so popular, and does it match the hype it is created around it, and how it is fabricated, sir?
Invisalign is one company. It's a corporate company who's been like, who actually I would say invented the concept of aligners. So the actual terminology to use would be use of aligners and not Invisalign as such, because there are 1,000 companies as far as aligners are concerned. Okay. Yes, why Invisalign is Invisalign almost, I would say, invented the system in 1997, and it wasn't really working so well during the early phases. So 1997 to 2017 is 20 years. So they evolved all the way from 97 to 2017, and 2017 they started to give really high-end aligners, which works fantastically. It's all completely a computer design protocol. So, and after 2017, I personally started to use Invisalign the moment it came to India in 2017. So it's almost my experience with aligners had been for 4 years, and I personally prefer Invisalign because it gives results fantastically. But ultimately, it's not that the Invisalign result is the same result as what I would give with a fixed appliance, with a metal appliance, or even a lingual appliance. It's not that the result is very superior or something. The mode of achieving is a little different. So with Invisalign, the mode is completely different, but the result is all the same. And Invisalign has got its own advantages. One is, especially during this COVID while, when patients cannot come so often for activations to the orthodontist or the dentist. So Invisalign is a system which works right from home. So you can just manage even with the telecounseling or teleactivations, I should say. So it reduces, or imagine patients, those old days when patients say that, doctor, I'm here for just a month or two and I'm going back to US and I'm coming back only after 2 years. So can you give me an orthodontic appliance? I had declined so many of my patients before 2017 because I keep demanding that the patient has to come every month to activate these appliances. Now with Invisalign, I have no problem at all. I have completely planned the treatment. I have designed the appliance with Invisalign. So I just give them a pack of aligners. You see, 2 years, you can manage it all by yourself. You take care and they can self-treat it by themselves. So that is the reason why it has got so popular, because one is it's invisible, and whenever you don't want to really show it out, you can remove your aligners and you can present yourself in the society, or whenever you are back. I mean, the idea is you have to wear it for 22 hours. That is most important thing. And cost wise, it's cost a bomb, you know. So cost wise, it's still a liability, but somebody who can afford for, I would say Invisalign is a fantastic appliance as such.
So why writing and maintaining the case sheet is more important in orthodontic when it compared to other specialties, sir?
I would differ with this question. Case sheet maintenance is very, very, very important. Let it be any specialty for that matter. Let it be prosthodontics or endodontics or periodontics, any specialty for that matter. Case sheet is a discipline, basically. A good doctor or a good dentist always has a complete track record of all his patients with perfectly entered data as such from day one to the end of the treatment. Why probably it sounds more important in orthodontics? Because the duration of treatment is quite long. You know, it is almost 1.5 years to 2 years, or even 2.5 years in some cases. When you are like, imagine I at current I am actually treating around 200 patients. I have 200 patients who have got running orthodontic treatment, and 200 patients I am going to work for almost 1.5 to 2 years. So there's so much of data which needs to be added upon a patient's case sheet. So it's very important, because considering the long duration, it's very important that I make a entry, I diagnose, I make my records, and I monitor every month's progress, and I perfectly digitize it. Nowadays, I completely follow digital case records. I digitize this, and it's always useful. Imagine the patient coming back to me after 20 years with some issue or something or another, or a relapse or something. These case records really help me on checking out what I had given for the patient. And beyond all those things, ethically and medico-legally, it is a must that you have to follow a case sheet. I like it or not, I don't have a choice. Tomorrow there may be a medical legal issue and the patient can even sue me. It's possible anywhere in the world. So, and the first thing the judge is going to ask me is, doctor, can you please present the case sheet of the patient? If I say, sorry, sir, I don't have a case sheet of the patient, then that means all doom. I might be right. I might be absolutely right with the treatment which I gave. The moment I say that I don't have a case sheet, I am medico-legally vulnerable. So you don't have a choice. I have to have a case sheet.
Okay, sir. So out of the orthodontic topic, we have a separate topic, sir. Like pulse oximeter, it has been becoming a very important device in every household since 2020. So can you give us more information on the how right way to read the pulse rate on the pulse oximeter, sir? So how it differs for the people who is so fitter, like physically fit?
See, pulse oximeter basically shows two predominant values. Only two values. The third one is perfusion index is not so important as such. It is like the oxygen saturation that shows how good your lungs are working in your breathing physiology, drawing in the oxygen from the air and delivering it to the blood. Okay, so automatically if your lungs are perfectly working and it's in a healthy condition, the oxygen saturation should be really high on your blood, right? So it is going to come down your oxygen saturation if your lungs are not properly working. So definitely during considering the COVID scenario, when a patient has got a damage of their lungs, and especially in cases where asymptomatic COVID, the patient does not even realize that the patient is under a very severe infective phase and the lungs are getting pretty badly damaged. That time the patient does not even realize that the lungs are not working well and they're not delivering the adequate amount of oxygen to the blood. Okay, so in such cases, a patient on doubt, the pulse oximeter automatically slowly starts dropping from 99 to 95%, 93, 92. Then like, why the hell I was so healthy so long? Always it was showing 99. So why is it showing 92 or 91 now? That means something is wrong. So it is time that the patient approaches a pulmonologist and take a HRCT of the lungs and check out whether lungs are properly functioning. It is just not about COVID alone. Imagine a chronic smoker or somebody with a bronchiectasis or a bronchial asthmatic patient. They all have lung compromises. So the lung compromises reflect on the value in the pulse oximeter, and also the pulse oximeter helps you with the evaluating your heart rate, which is very, very important. Heart rate can fluctuate, and the fluctuations beautifully gets recorded in the pulse oximeter. So both these values are going to warn the patient that something systemically is not good, especially considering their cardiopulmonary systems are concerned.
Okay, sir, talking about the fitness, we all know you are a triathlon. So how do you balance your fitness with your lifestyle and work, sir?
Fitness is everyone likes to be fit. You as though it's like everyone likes to present with a nice physique as such. Everyone wants to dress well. You know, everyone you like to wear a beautiful salwar. I know the way you dress. You dress really well. So that is just that the human instinct to present themselves well. So when you want to present yourself well, you have to be fit. You have to have a good morphology. You have to have a good body structure, and that is about. A personal narcissism as such from one aspect. From another aspect, when you want to be mentally positive, when you want to be energetic at your work, you know, when you want to give your best as a dentist or an orthodontist, say any profession for that matter, you have to be fit. So with all these priorities, fitness doesn't happen just because having visions or passions to have a fit body or a fit thing. You have to put in some effort for it. And yes, I am a triathlete and I put in a lot of time into my fitness, but it is not too exuberant as it's being thought around. It is just 1 hour every day, but at any cost, I don't miss that 1 hour every day. And I should say this has been more than 15 years. My fitness journey is. At one time, it became more adventurous and very passionate about it. Those are the times when I trained for a triathlon where I had to run, swim, and cycle non-stop for 10 hours to 12 hours. Okay, and then end of the day, it's like something which I enjoy it. You know, it gives me that endorphin boost and makes me really feel confident and makes me really feel special about myself. So that's uh, my idea about fitness.
So how this journey for your fitness started and how it is keep on going, sir? How you dedicate yourself to it, sir?
Okay, so it was like I was always fit from school to college into some type of sports or another. Then so I'm 45 now. So when I touched 28, 29, slowly I could feel that sense that my fitness was slightly coming down. And when I climbed stairs, I was panting and I wasn't as energetic as I used to be during my childhood. And at the point I realized that something was going wrong, then I was not putting in that adequate exclusive time on daily fitness programs. Then at a point I started to put on little weight also, which was never happening all through my childhood or during college days. And okay, there is something which is inevitable as you age, right? Your body systems slowly start declining with what it used to be from your the peak of your health, that is your school to college days. That time I thought like, okay, yeah, so I am losing my fitness, so I have to put in some extra effort. Not that natural fitness is all getting down, so I have to force myself into a fitness lifestyle. It's not that one day I go to the gym or one day I run on the roads or one day I cycle. I have to make it like a habit. So every day I have my bath, every day I have my lunch, every day I have my food. So like this, it's like this 1 hour has to happen every day. So and it was it started with some passion. It was definitely difficult because some days you really feel like working out, some days you feel so lazy. But once it became a habit, I mean, past 15 years, it's been rolling continuously. There's no choice looking back.
Okay, sir. Is orthodontic as complicated as it sounds, and can it made be so interesting or fun, or it is all in our minds, sir?
Hana, I don't expect this question from you. A brilliant student like you, it's like I know you are a prodigy, and nothing is difficult for you, right? That's the way I've seen the way you take up dentistry in college. So as such, orthodontics is not difficult at all. It is a wonderful science. It is so easy. It is completely. It's a lot of physics and mathematics. It keeps making your mind calculate. Every case is so special. Every patient is so special. So you have to. This equation is not the same for every patient. So it is just learning about the equations. Like I wouldn't say mathematics or physics is tough if you like mathematics or physics. The same applies for orthodontics also. People find or there is a mist or a feeling that it is tough because you're not adequately exposed to orthodontics in your UG curriculum. That's the way, not just the curriculum of Dental Council of India, the global curriculum as such in undergraduate dental education does not bring so much of extra weightage for orthodontics. So this is one field which is not so much explored as an undergraduate. So undergraduates all feel that orthodontics is tough because they're not exposed to it. The moment you expose yourself as a postgraduate, you know how easy it is. Definitely, I would say tough is a wrong term to use. It is absolutely an interesting and an easy field to pursue for.
Okay, sir. If a student was to choose the orthodontics as a specialization, what key reason would you give to say yes and encourage them to this path, sir?
It's like my first choice for a postgraduate, UG was like transcending or escalating themselves as a postgraduate. The choice of specialty would be blindly orthodontics. Because that's what I pursued and I'm enjoying it. So let all you guys enjoy orthodontics. Why? Because imagine you have the power to change someone's face. Make someone really pretty, make someone feel so confident. You have the power to improvise the oral functions. You know the technology, you know the science, you know the art, you know the medicine behind changing someone's occlusion for betterment of function, betterment of aesthetics. When you have the power, I know you feel so special. So this is one field really which makes me feel so special. That's the reason I chose orthodontics, and that's the reason I would ask any undergraduate to pursue orthodontics as the postgraduate curriculum.
Thank you, sir. It was wonderful experience talking to you, sir. Thank you for your time and exposure towards the orthodontic field, sir. Thank you so much, sir.
My pleasure, sir, and all the best. You're doing a wonderful job, especially imparting knowledge and education. And keep up the spirit. You always made me feel so proud. It's like, and I expect a greater glory and greater achievements from your end. All the best, Sahana.
Thank you, sir. Thank you so much, sir.